Thank you again for meeting with me. As I mentioned when we scheduled this appointment, my role is just to help provide a thorough analysis of what happened with the Torres event. We recommend that this is to be used for debriefing only. This is not to find fault, and it's not to assign blame. Your questions and your responses to this will be kept confidential. Your results are only going to be used to help assess what happened, both individually and as a system. So what could we look at that we can do differently in the future, hopefully to avoid having an adverse event like this occur again? I'm going to be reading some questions to you from this form, but again, be assured that completed forms will be destroyed and data will only be reported in a de-identified, aggregated manner. I want to stress that it's critical that you provide an accurate and unbiased result of what happened. Your perception of the event, I think, will provide valuable insight, and we'll use it to compare to other cases that maybe had similar outcomes and identify trends in system-related issues. Responding to these questions may also contribute to your own self-assessment of what happened and maybe what could have gone better. Be as informative and specific as possible. Please specify exactly what happened as you recall. After we speak again, this information won't be reported to your manager. It will only be reported in a de-identified, aggregated manner. So I just want to assure you that your comments can and will be used, hopefully, to make things better both for you and for other patients and childbearing families. There are different segments to this form. They're going to get at system-level factors and other factors that may have contributed to this event. I think one of the most important things we found that sometimes contribute to adverse events are communication, both between care providers or perhaps between family or between you and the family. So I'm going to start by just asking you a couple of questions that have to do with communication surrounding the event. Did you note any inter or intra-departmental communication breakdown? For example, was there any conflict between you and co-workers that you think might have directly or indirectly contributed?
To be very honest, our team is a little bit cliquey. There are groups of people who help each other more than others, friends helping friends. Unfortunately, my friends weren't on the unit that night, so I felt very alone in that respect.
Did you note any problems with shift change, or were there problems in patient handoff that may have occurred?
As far as nurse-to-nurse report goes, I didn't feel like there were any problems, but we did get on the unit knowing that we were all going to receive 2 patients that night, knowing that we were short-staffed. That was kind of the energy that was on for the night shift.
So are there any other things that you felt like might have contributed to a breakdown in communication? I noticed in the event report there was some recollection about the STAT system and also your Vocera system. Can you tell me about that?
So unfortunately, on different parts of the unit, the Vocera system can be very spotty. There can be places on the unit, certain rooms that don't have really great service. I just remember the first time I pushed my Vocera button, I realized where I was on the unit and that I wasn't going to be able to use my Vocera. At that point, I paged out with the phone, but that's just an overhead page. And then as far as the STAT system on the unit goes, I feel like it can be very confusing. We use a STAT, double STAT, triple STAT system, which I feel can be very confusing when you're trying to get providers to the bedside quickly.
So another breakdown in communication could have been response time. I noted there was a bit of a lag in response time from when you paged the attending to when he came. Can you tell me a little bit about that?
Well, from the first STAT page that I used to page Dr. M to the time that he did get to the bedside was about 45 minutes. It felt like hours, but in any situation, I feel like time moves slower.